Hi, I'm Madhvi Reddy. I'm with Dr. Sita Lakshmi,
Right.
cosmetic gynecologist. So I have a few doubts about menopause and other treatments related to menopause. So I want, ma'am, you please answer my questions and
Definitely.
clear my doubts. Okay, ma'am, first question would be what are the menopausal symptoms exactly?
As you all know, menopause is a period of time in women when they start noticing the changes in their reproductive organs. They also notice changes in their own health in the form of low energy and some irritability, hot flashes, and also a decrease in the periods or complete cessation of periods. This is called perimenopause actually because it is in and around the age of the menopause. That is, it may start around 4 to 5 years before the actual onset of menopause. Most women panic in this period thinking that everything is going to stop comes to a halt. It's not like that. There is a decrease in the hormonal production, therefore, you see these changes. Sometimes there are fluctuations in the hormone productions, and that's why you see certain symptoms like hot flushes and all, which are basically because of an increased estrogen production, which is thrown into the circulation. So, apart from this, uh, people are worried what happens at the time of menopause. At the time of menopause, usually the first and the most important noticeable sign is cessation of periods. So the cessation of periods, arbitrarily we call it a cessation for 1 year without even a single spotting in any of the months. It's considered to be a menopause.
So we have a few doubts and myths about menopause. So can you please clear some? For example, like we feel like menopausal state may lead to cancers. Uh,
Yes,
that's it.
the moment women are always worried about their reproductive health and they safeguard it very well. Most of the educated women know what to do and what not to do. But the most important myth is there an increase in the cancers that I'm going to face in the body because of menopause? Undoubtedly, there is no doubt that menopause can increase certain heart health risks, but the cancer risk is same as before, and there are actually the hormonal losses are there more. Therefore, the tissues get very devitalized, and it is almost the cancer risk is almost equal to the normal population.
So what are the problems we can expect in the menopausal stage and age?
Yes, there are two kinds of problems. One is the physical problems that they are going through because of the menopause. There is a decreased production of hormones, and they start getting these night sweats or hot flushes, irritability, and the most important thing would be some changes in their reproductive organs cause alarming symptoms like increased urination. Uh, this is called stress incontinence, actually. So other myths are like emotional challenges, that is, feeling low, lack of interest in daily activities, getting secluded, not able to socially mingle with people because of either the emotional changes that they're going through or because of the sexual changes that they are going through, and they feel very low and very depressed. So this also has to be addressed at the time of counseling so that we can help them in a better.
So that was actually my most important question about urinary urgency. And next would be what would be the menopausal problems which pertain in women?
Yes, the thing is like there is a first and foremost, again, we have to address if their activities are getting hampered in some way or the other. That is, their social interactions are getting lower because either because they have to frequently go to the toilet and or there is a decrease in the emptying feeling and always they feel the bladder is full. So they're worried that they cannot take long journeys. They may have to use certain type of diapers, so this is a constant trouble, and using such diapers or such have facing such issues can cause a lot of rashes around the perineum, and this is an added discomfort. And the skin around the genital organs can become very much dehydrated or chapped. This can lead to other infections, which are initially not noticeable, and later they can cause a lot of problems.
And next, I have heard a few things about genital laxity and what is it about?
Yes, as you know, youth, the fountain of youth is estrogen. And you know, the breast development happens because of estrogen. The fat in the women is estrogen mediated, and fat in all the organs is estrogen mediated. And the tissue vitality and the shape is brought about an estrogen mediated growth. As the estrogen and the progesterone balance is getting disturbed, and there is a loss in the tissue organ, that is the amount of fat in the tissue, there is a change in the type of collagen in the tissue. Therefore, there is a laxity. That is, they feel that their genitalia are very much loose. And some people, some women actually feel that there is something that I feel is coming out of the vagina. They describe it as a heaviness in the lower part of the vagina. So this is definitely an important sign. We have to examine whenever they have come for a consultation. We have to see that the genitalia or the internal organs, is there any laxity, is there any descent, and accordingly we have to advise the treatments for it.
Okay. What are the changes we can expect in the reproductive system and also any specific treatment to solve these problems?
Yes, you know, reproductive system composes of the uterus, the ovaries, the vagina, the outer layer, that is the labia, and in the labia there are two types, the labia majora and the labia minora, which are covering the genital organs. In the cosmetic gynecology, we are mostly concerned with the external appearance of the genitalia. Some people know that they had a better shape, and they were happy dressing it, the dressing in a special, in a normal way. And now, because of the changes in the laxity or in the labial tissues, they opt for changing their dresses, and they don't feel comfortable in certain type of dresses. So that is the time then they can opt for a change or a reshape or regenerate these tissues. Fortunately, these are all outpatient based programs, and they can be finished in a few hours and they can resume their life normally.
Are these cosmetic gynecological treatments safe and effective?
Yes, cosmetic gynecology treatments are often asked for, and there is an increased demand nowadays because you know women are much more active beyond their menopausal age. They are solving their own problems. They are very special people in the society. They could be in a very higher hierarchy positions in their own companies, which demands more and more activity. Apart from taking care of their physical health, they are also concerned about their genital health. Therefore, they come for various treatments like vaginal rejuvenation, which gives a better feeling of the vagina. There is a better moisturization, dryness decreases, and therefore excoriations and infections are controlled. Apart from that, as I told you, urinary incontinence can be a major problem, which can be tackled with various lasers, energy based devices like RF, and various other minimally invasive treatments.
So, what else do you have in non-surgical and surgical treatments related to these?
Yeah, the surgical treatments are basically for the appearance of the genitalia. So, a few patients actually come for the clients actually come for the surgical treatments, that is the labia majora, reshaping, or fat filling, or hyaluronic acid fillers can be added to reshape them and give a good appearance. Apart from that, as the descent of the organs happens, there is a descent and more increase in the fat in the mons pubis. So this can be dealt with a minimal liposuction and give a better appearance, and they can wear modern clothes in a better way. There is a less chafing when the labia majora are restructured and positioned in a proper way. Apart from this, lasers are used, as I told you, to control the urinary incontinence and to give a rejuvenated vagina. This leads to a better sexual life and a better happiness in the.
So, can you give us some information regarding genital atrophy?
Yeah, genital atrophy is laxity combined with the loss of tissue. Laxity happens initially, so there is a displaced fat. So there is a fat in the labia, but it is not positioned equally. That is laxity. But in the case of atrophy, it is the tissue is totally damaged. You know, the collagen is completely damaged in the tissue. Therefore, the tissue looks shriveled, very thin, and devoid of life. So these tissues can be regenerated with energy-based devices like the RF or the lasers, and then fat can be used as a fat grafting to give it a better shape. Similarly, vaginal tissues also undergo atrophy. If the vaginal atrophy is seen, this could lead to many serious conditions like excoriations, leukoplakias, and or adherence. Both the sides of the vaginal wall can adhere to each other and cause a lot of discomfort in urination itself. We have seen in many women complaining of a lot of pain in and around the vagina. This is called dyspareunia when it occurs during the intercourse, or there could be undifferentiated pain in the vagina. Therefore, a thorough examination and rejuvenation can help them to lead a better life. Apart from this, though it's not labeled as a treatment, many of the vaginal infections, chronic infections, can be controlled. Fungal infections can be controlled with the CO2 laser. One session could be very, very useful for such kind of. So, in all, cosmetic gynecology is a myth because we are actually treating the functional problems that occur in the menopause. So, most women do not know that they can approach a cosmetic gynecologist who is specially trained for these treatments and can give a better choice of treatments.
Thank you, doctor. This is very informative and hope it helps everybody, whoever is watching this program. And you can contact Dr. Sita Lakshmi for further information.
Thank you.
Thank you so much.